hello everybody who's interested in our HARP PhD program. HARP, which stands for Health Advances in Underrepresented Populations and Diseases. We would like to discuss a couple of questions today regarding our program and something which might be important for you as you apply for this either a PhD or a pre-doctoral fellowship for 1 year. One of the important elements of HARP is public engagement. So how researchers, maybe clinical research or even basic science or animal research, could be related to public involvement. Professor Edel O'Toole, one of the directors of this program, has long-term experience on public involvement. So Edel, may I ask your opinion about public involvement? Why is that important for researchers, even at a very early stage of their research, such as in the pre-doctoral year or in a PhD?
Public involvement in research is important as it improves the quality of your research by contributing different perspectives and experiences. It's also important because the public, so for example, patients, potential patients, people who use health and social care services, carers, people from support organisations that represent patients, all have an opinion on what actually is important to research. And that's very important. So, for example, in my own area of research, ichthyosis patients are really keen to know why they're so itchy, so they're very itchy because they've got a lot of inflammation in their skin. So we're working on trying to characterize that inflammation a bit better.
So this is obvious that Professor O'Toole is a dermatologist. So I think that some people might have the idea that public involvement research is that you're actually doing research on members of the public, and therefore that's your public involvement. So is that really the case?
No, there are three components which are linked. So there's involvement, where patients or members of the public are actively involved in the design and conduct of the research. So, for example, as part of an advisory group, they might review your lay summary or your application. They may help with identifying research participants. They may help with developing materials or questionnaires, and they may help with disseminating the results. Engagement then is telling people about your results. So why is it important? What you found out, and what are the impact and implications of the results. And participation is actually when members of the public take part in a research study. So, for example, a patient participating in a clinical trial, or a patient donating a biopsy for research.
Del, can I ask? So I'm often asked, and I suspect you are as well, that by people who may be doing, like as Professor Kormanitz mentioned, more basic science research, that are the public really interested in that research, and can they really disseminate their findings? I mean, I'm sure we've all got our answers, but what would you say to people who ask you that?
So in my experience, the public are really interested in that sort of research because they realise that basic science research leads to new advances. So, for example, finding a novel target and a new treatment, as opposed to, having a look at some old existing treatment. And certainly in my experience presenting to patient support groups, they are interested in the basic research, but it has to be explained so that they can understand it. That's really important.
Very good. So I wonder if I could ask Will or Lien about some other examples where in your personal kind of experience, you had public involvement in a way which is not being just a participant whose blood sample or tissue sample or kind of questionnaire results are used.
Yeah, I mean, if we think about some of the research I've done where I've worked with recovering after critical illness and survivors of critical illness, we often spend a lot of time with people who have been exposed to intensive care and critical illness, finding out what they think are important elements of their recovery. So what outcomes should we be measuring in our research? What do they consider important to them? And they'll help us refine the outcome set in doing those sorts of studies. And that's really valuable in hearing what patients and their family members think were important as they recovered after critical illness.
So practically, you are asking your patients that what are the points which are important for them, and therefore you can design in your next study, the questionnaire for those who underwent a procedure or who survived a critical illness.
Exactly. And in thinking through that, some of those questions might be that you could put them to a general member of the public and just seek their opinion more broadly. But for some of those questions, we'll want somebody who has the specific experience of having been a patient in my instance in intensive care, but other services as well. So you do need to think about whether it's a general member of the public with their general views, or if you want a patient who's had the specific experience. And you often do see those two terms, public and patient involvement, interlinked. So you need to think about what's important for your study.
Very good. How about Will? Do you have?
Yeah, so actually, really echo what's just been said. And I'm a hepatologist. A lot of my research is basic science, but it does involve patients who have maybe taking samples from patients. And one of the questions that we asked, I remember in a project that we put together, was we were being challenged as to whether patients might find it acceptable to, in this particular case, be randomized to one of two intervention arms. And so we went out and we asked patients, and we went to see, well, actually what we learned was absolutely they were happy to be randomized because they understood that what we were asking was a question that didn't have a clear clinical answer. Therefore, we genuinely had equipoise to that particular question. And actually, kind of almost to answer my own question to Edel, we work a lot with the Diabetes Lay Panel, who advise us, the North Thames Diabetes Lay Panel, who are fantastic and will always make sure that anything we write, as molecular and as detailed as it might be, but make sure it is accessible. And so I have to say my writing's always improved by making sure that friends and colleagues in the lay panel get a chance to read it first.
So let me also give you an example which is slightly different from these ones. So in my case, we wanted to collect some samples from a certain group of people, and I had a kind of a vague idea how we should go about it and discuss it with some members of the public. It turned out that that will not be a very good idea in this particular situation at all. And they came up with a much better idea, which was extremely successful at the end, like a lot better than we even hoped at the beginning. And clearly, I would never be able to come up with that thought because I'm just not approaching the issue from the way some other people would be able to. So working together with the public who have a different kind of approach to the problem which we are facing was extremely helpful for me.